Hi, colleagues. We'll be starting in a few minutes. Thank you for joining us early. Appreciate it. Hello, colleagues. Welcome to those that just joined. We'll be starting in a couple of minutes. Thank you.
Hi, colleagues.
Hello, Max.
Hello. Hi, Andres. Hi, Gonzalo. Hi, colleagues.
Hello. Hi, Max. Also, hello, everyone. We are now connected and we have already 44 people in the meeting. So I'm going to share in the meantime, while we give a couple of minutes for other people to join, a Menti, we would love to know who is in the room and which organization you are representing today. So please use the QR or the code shown in the screen to go to Menti and let us know which organization you are coming from. Thank you. We will start in a couple of minutes.
Let's wait another minute and then we'll start. Thank you. Thank you very much, colleagues. Welcome, everyone. We're very happy to have you today. We see that you are from many different places. We're happy to see such diversity of colleagues and organizations joining us. My name is Andres, and I am leading the SBC monitoring team from UNICEF, and we're very happy to be with you today. We have a brief agenda that we're going to be covering today. And for that, the first item on the agenda that we'll be covering is having our social and behavioral change senior advisor for UNICEF, Massimiliano Sani, who's also our deputy global lead, have a brief introduction words for us about this effort and this work. Then we'll have Rebecca Smith, who has been leading this effort over the last years and who's going to be introducing overall the approach for the exercise and also some of its key features. Then I'll go over some key indicators that have been part of this work that we hope will be useful for your implementation. Also, hoping that you can also integrate them more into your monitoring work. And then we'll have Sarah, who has been developing the dashboard and now it's open to the public, who's going to be doing a quick walkthrough and more recommendations on how you can take advantage of this effort that we have done. Without further ado, I would like to introduce Max, our senior advisor and deputy global lead, to give us a few words of welcoming. Max, over to you.
Thank you so much. Thank you, Andres. Hi, colleagues. Good afternoon here in Nairobi. Good morning, good evening. It's really today a pleasure for me to open this webinar, actually, where the UNICEF SBC MNE global team will introduce some, I think, really precious resources that were designed to better inform our theory of changes, to refine the result structures of our SBC programs, and to enhance overall the measurability of our intervention. We firmly believe that these resources can be useful to both internal staff in UNICEF, both SBC staff and program staff, but also to our external partners. Hence, the extending the invite to the members of the SBC Global Alliance, for example, to the network composed by our partners and vendors in the long-term agreements that we have for SBC, among many others. I will be very brief in my opening, of course, because the agenda is quite dense, but I wanted to share a couple of reflections with you. When Andres actually asked me to open the webinar, I actually thought back to my first days and years, I would say, with UNICEF, when over 15 years ago, I was working with UNICEF Angola. I was supporting our country office to advance several SBC initiatives, particularly on health, and I would say with a big focus on polio eradication. We were running so many campaigns at the time to get the wild polio virus out of Angola. And I still remember actually the pressure to report to results to the donors, and at the same time, the limited available guidance we could find to determine the success of our intervention. Beyond, of course, tracking, simple process indicators like our reach of our initiatives or a community engagement or SBCC initiative, and perhaps, assess the level of exposure of our caregivers that we were engaging on polio to the social mobilization efforts that we were running before the vaccination drives. So honestly, I wish that at that time I could use the resources we are introducing today to elevate the sophistication of our MNE frameworks, basically for SBC. Now, honestly, it looks like we are in a different world, and with such quality guidance available, produced by our SBC MNE experts, particularly many of SBC results that will be introduced by Becca, and then of the list of SBC standard indicators for cross-cutting programming in development and emergency that Andres and then Sarah will introduce later on. So without further ado, colleagues, I will pass the floor to Becca. Yes, I wish everyone a successful and interesting webinar. Becca, over to you. Thank you so much.
Great, thank you so much, Max. I'm actually going to just ask my colleague Gonzalo if you'd like to step in with a note about how we can interact with each other during this webinar.
Sure. Hello, everyone. Just a quick note on the questions and answers you may have. Please see an icon in the top menu of the webinar where you can enter the question and answer panel, and some of the questions will be answered by our speakers right away, but others will be kept until the end for the live Q&A session. Thank you very much. Please go ahead, Becca.
Great. Thank you so much, Gonzalo. So I'm going to do a quick overview now, as Max mentioned, of just the motivation behind developing this global resource and a bit about the process for development and some of its key features. So originally, with the idea behind the menu of SBC results and indicators, it came at a time where we were trying to have an organizational evolution within UNICEF. So moving from communication for development, or C4D approaches, to a broader set of tools and approaches with social and behavior change, and really wanting to support that with methodological guidance and advancements as well for how we can measure results and use those results to have more SBC data and evidence to inform program design and monitoring, and overall have a better understanding of what change is happening and how it is happening. So partly here with the menu, one of the objectives was to make those SBC contributions to program results more visible and really understand what SBC results look like. And with a particular focus looking at a so-called kind of missing middle of intermediate results that happen between your activity tracking and your prevalence monitoring. What is that stuff that happens along the way that helps us to understand and to really know what is happening along a results pathway to achieving results for children? And what we wanted to do is produce a resource that had tested and robust indicators and results frameworks that could be used for a variety of purposes, obviously for strengthening monitoring, but also for designing research studies and data collection instruments, and for informing strategic planning, and even embedding where possible in national or institutional frameworks. So what exactly is the menu of SBC results and indicators? It's a large comprehensive catalog of indicators for children across all of UNICEF's programmatic areas. Now, each indicator comes with some metadata and methodological guidance, such as where it sits within a results hierarchy, whether it's an output, intermediate outcome, or outcome, as well as the purpose for using that indicator. So in what situations you might want to select a particular indicator over another indicator, as well as the source. So I think it's important to note we didn't create any new indicators for this menu, but we did a large scoping of existing indicator sets and data collection instruments and program guidance materials to source those indicators that have been used before and applied in different contexts and that were most relevant to capturing SBC results. Where possible, we included the actual survey questions that have been pre-tested and conceptually validated to support the integration of those questions into, say, data collection instruments. And we also provided suggested means of verification and method of computation for each indicator where we could. And lastly, we aligned each indicator in the menu with dimensions of the behavioral drivers model developed by UNICEF, as well as a socio-ecological model. So I'm going to talk a bit more about those and give some examples later on. But finally, I'll note that most of the indicators in this menu can be used in either a development context or in humanitarian and emergency programming. There is a specific kind of module for humanitarian action indicators within the menu, but really most of these have that flexibility where they could apply in a variety of different contexts. So I really like this image here because it really illustrates what we're trying to do in capturing that missing middle of results. And you have your activities monitoring, maybe that's reach, numbers of people reached or numbers of healthcare workers trained. And then you've got your prevalence monitoring, for example, rates of immunization coverage or educational attainment. But what's happening in the middle is a lot of different factors that are messy and nonlinear and somewhat unpredictable. And so what we really need to do in terms of enhancing our understanding of how we can deliver better for children is to understand what is happening in that middle, what's happening at an individual level, at a society or community level, and make sure that we're also understanding all of those supporting factors and those drivers that come into play that help us to achieve the behavior change that we're trying to achieve. So here I have a very quick overview of the process for developing the menu. It really was a collaborative effort led by the SBC team, but in collaboration with all different teams across UNICEF, starting with a consultative process with over 65 specialists in different technical and geographic areas across UNICEF, and scoping about over at least 140 different documents with research instruments, program guidance, et cetera, to identify relevant indicators for inclusion. Based on those early consultations as well, we developed a set of user personas within UNICEF to better refine how we could make the menu as user-friendly and as relevant as possible for people's different needs. And then based on that, developed some draft indicator lists for each of the different program areas. And through a process of ongoing kind of iteration with different specialists from different teams, we agreed on what were the priority indicators to include, what were the most up-to-date, the most relevant, and finalize the metadata so that we could launch the menu. First launched internally within UNICEF. So it's been in use internally for some time now to help with strategic planning and designing, monitoring approaches and results frameworks, et cetera. And now finally, we're able to launch it externally. Very excited to do that. So going back to what I mentioned about the alignment with the socio-ecological model, here we have some examples. You'll find 5 different dimensions of the model and just some examples of indicators related to results for violence against girls, boys, and women and the disclosure of sexual violence. And if you want to, say, particularly look at indicators that are related to the individual level in the socio-ecological model, as Sarah will show you later on, you're able to filter in the dashboard to be able to look at those indicators that are of highest interest to you. So you can see some at the community level if you wanted, or any of these levels, and scroll through to find what's most relevant for your programming. Now, for the behavioral drivers model, this was a great resource developed by UNICEF. If you're not familiar with it, it includes a set of behavioral drivers in 3 different aspects. So we have psychological drivers in green, sociological drivers in orange, and categories of environmental drivers in blue. And then there's another subset of dimensions here that you can see within each of those categories. And so what we've done is to indicate within the metadata for each indicator how it aligns with a particular aspect of the behavioral drivers model. So just to focus on one example here under attitudes, which is a psychological or individual level set of indicators, we have people's individual belief systems and how that affects what they do, what kinds of decisions they take, how they make decisions. And the example here is the percentage of people who believe that their religion requires FGM. So I think we'll go into more depth, again, as Sarah walks through, and you can see how we've tried our best to make the dashboard user-friendly so that you can apply different kinds of filters and really focus in on what's of great interest to you. But the menu provides essentially a wide range of options. It's not a mandated set of indicators, but it gives you a great variety of different kinds of options that can be tailored towards a particular use case or a particular context to find the most relevant and robust indicators for your purposes. So I'm going to pass over now to Andres to continue on.
Thank you very much, Becca. Thank you, colleagues. We have some questions already popping on the Q&A button, so please keep them coming. We're going to be active there, so this is a more of an interactive conversation as well. Now we're going to go into the next session. This section is going to be, we're going to be talking about what are specifically these sets of indicators. This is also part of the work that we have been developing over the last couple of years, because not only there is a need to have a clearer understanding of what are some existing indicators, but there's also a need to have SBC specific results and indicators that can be adapted to multiple programming options. Actually, that's one of the questions that we have in the discussion part by Juan Antonio from Laos. which is very important, right? Like how can we have specific tools that can be adapted to multiple areas? So we're going to be seeing 3 of these that we have been developing over the last years. So basically, what are these SBC standard indicators? The standard indicators are predefined, adaptable, and recognized measurements to track progress and performance across SBC results for different program work and also across different sectors. Why is this important? Because these are indicators that have been widely used, but now we have adapted them specifically for SBC results, and they have the capacity to be adapted to different types of areas of working. We're going to see a couple of examples. These standard indicators are designed to be adapted, as I mentioned. They're established from pre-existing indicators, so they are already been tested and tried in the past. And we have developed methodological notes for their adoption and implementation. So this is very important because if you were to be discussing key results with a government partner, key results with a statistical agency, this allows you to have available already methodological notes. So you don't have to invest more money in developing something, testing something that is already has been created for that purpose. What are the different set of indicators that have been developed so far? We have 11 that are related to cross-cutting results. That means results across different areas. We have 6 that are related to SBC in emergencies, specific results. And we have 3 that are that we use in what is called humanitarian action for children appeal. But you're going to see are also some of the more traditional SBC and classic C4D approaches that are still being used and are still important to fortify in our approach to measuring program results. So these are the cross-sectoral standard indicators. You're going to be able to see here the result or the domain that it relates to. At the same time, the specific indicators here. As you can see, we have indicators that are related to learning or skill acquisition when we do trainings, that are about coverage or community engagement as well. Another important area that social behavioral change is working more and more is about data generation and evidence in terms of behavioral change, for example, public health emergencies. We have indicators that are working as proxies of trust, in this case, perception of inclusiveness and responsiveness. We have indicators related to barriers to accessing services, normative expectations, and the classical behavioral results that we're also looking at, knowledge, change of knowledge, whether or not we can measure change of beliefs and specific attitudes that we're looking to have either more positive attitudes or reduction of harmful attitudes, and indicators that also measure self-efficacy and behavior change overall. So as you can see here, these are very useful for different programming purposes. A little bit on the structure, for example, here if we see the one on belief, these indicators are adaptable in the sense that this portion that is bold can be changed. So for example, here, this indicator in belief could be percentage of mothers who believe it is important to adopt a nutritious food for children on the area of intervention. So you can easily change these to different things. Percentage of parents who believe it's important to adopt positive parenting when raising their children. Percentage of teachers who believe it's important to adopt positive and discipline in the school room. So there are different ways that these different indicators can be adapted, and that's one of the specific strengths of these indicators is that it's targeted to these specific SBC results that we're all working towards. The second set you're going to be able to see here are those related to emergencies. And again, you can see here what are the domains or the results it relates to, and then the specific indicator related to them. For example, we have indicators related to emergencies, situational data, something that we do a lot when we're working on emergencies in the SBC field, when we're doing supporting community engagement and what is the role of community engagement in emergency planning, preparedness, and response. Both at the level of number of emergency plans where it's integrated, as well as the percentage of work plans that take into consideration community engagement inputs. We also have one that goes beyond emergencies, but is very important, is how many number of interventions are being conducted and applied for behavioral science or human-centered design. We know this is something that a lot of different organizations in SBC are working on. And we have a complementary indicator on learning and skill acquisition and coordination for community engagement, another very important role the community engagement SBC program takes. And as we were mentioning before, we have like these classic results that are the ones that we have been working in the past and usually are measured. But here we have um, refined a little more carefully how the different ways of counting reach of people, counting community engagement, and counting digital engagement can be measured. So here we have indicators related to reach, but in each one of these, you're going to be able to have specific recommendations on how to measure reach across different channels, including digital channels, in-person channels, more traditional methods and media. So in that sense, it will help. We hope that it will help standardize a measure across the sector that sometimes we do have different approaches. We also did a very important differentiation between its community engagement and digital engagement, as we know that they have different dimensions. Community engagement processes do not have the same numbers as digital engagement processes, so they should not be mixed up in the same indicator. So what we're proposing to you and to the sector as a whole is that we have different indicators for them. So in the long term, we are able to measure them separately and at the same time more accurately. So this, I know that you're gonna hopefully be using this a lot in the future. So you will find detailed methodological notes there with the specific recommendations for different channels and how to account and measure them. So we're going to see one specific example and using other tools, right? Because it's not only about indicators, it's also about how do we apply this in a context of planning, in a context of communicating what we do. So this what you're seeing right now is what we call the general SBC theory of change. It's a big thing, right? It has a lot of things, but this is a tool that we use to put in front of you and everyone all the different results that the SBC programming can do. This is not the specific ones that are going to be used, but all the specific ones that are possible to exist, at least from a consideration from UNICEF programming. So what do we do usually is we take a look at this SBC theory of change and then we adapt it. We adapt it to something like this. So we go from the big one towards a more specified theory of change to the specific results of a specific program that are that respond to the context of a given country, identifying then what are the key results that should be looked at. So for example, here, this is a sample theory of change for SBC programming for the elimination of violence against children. So here you're going to see some of the outputs that traditionally are being used on these kind of approaches. We have outputs for knowledge, positive beliefs, things like leadership, ownership, public discourse. Then we have the identification of how these outputs are contributing towards intermediate outcomes. We have intermediate outcomes like change in positive social norms, attitude towards change in the community, whether or not we are having more inclusive communities, increased family and peer support, participation, conducive communication environment. And then we have the larger or more long-term results that we're pursuing, things like the abandonment of the harmful behavior that we're seeing. For example, here it might be violent discipline, the increase of gender equality that might exist in a given community, the strengthening of the social cohesion, or the more responsive institutions and governance that we're looking to build on the areas that we're working on. So these all these different SBC results are contributing towards these larger approaches that the organization or a country is pursuing. For example, reduce violence against children, reduce gender-based violence, improve social cohesion, that at the end have an impact at this level, which is reduce inequality, better life expectancy, reduce discrimination, increase gender equality. So through this way, we can easily identify what are the specific things that we're doing. For example, if we were to have a specific programming in one of the areas of intervention that works about collective efficacy, we can easily build the path through which the collective efficacy that we're working on contributes toward inclusive communities. And if we tie indicators to each one of these areas, then we're going to be able to prove or show at least progress on the specific areas that we're working on. And then once we have inclusive communities in the midterm, then we are going to be moving towards more social cohesion that contributes towards reduced violence against children. So why is this important? Because once we identify the results, we can go into identifying the specific indicators. So for example, once we know that we have a result, we need to be looking about social cohesion, then we can go into the menu of results and identify one of the key indicators that could be working for our programming. In this case, for example, percentage of people in target areas with improved perceptions of social cohesion. So this is one of the indicators that you can find in the menu of results. Then we move into the intermediate outcomes. If you put increased participation or inclusive communities, there are multiple options. So you can, we're going to see this with Sarah, you can search by keyword. But here, for example, you have other indicators that are included in the menu of results. For increased participation, numbers of persons engaged in community platforms, reflective dialogue towards the abandonment of sexual violence. Number of boys and men actively participating in group education addressing harmful masculinities. If we're looking at inclusive communities, number of local governance systems supported increasing social cohesion, or the extent to which the mechanisms for community engagement have a strong and diverse representation. So these might be some indicators you could implement. You should take a look at each one of them, the metadata that Becca mentioned, and see if these are the right for you based on what data you have, and also what are the capacities for you and other implementing partners. Then the final example here is SBC outputs. We see participation opportunities and collective efficacy, some indicators more on the output level related to the belief of adolescents, if they should be participating in addressing issues affecting society. This is one of the standard indicators that is being adapted here, the percentage of local governments with functioning mechanisms for participatory community engagement. And then we have some process indicators that are also important in order to show the more specific activities that we're doing, whether or not we're routinely in a routine collecting and publishing key tables of administrative data, and whether or not there are national behavior change strategies in place. So with that, I know it was a lot of information. We're gonna have a chance again to see some of those questions from you. So prepare those questions in the Q&A or also for the last part of the session, but I'll hand it over to Sarah so she can give us a walkthrough and see how we can use this tool that now is available for everyone. Thank you.
Thank you, Max, Becca, and Andres. And just give me a minute. I just switch screens so I can show you how the dashboard actually looks like. Thank you. Yes. Are you able to see my screen now?
Yes, we are, Sarah.
Okay, yes. Just like Becca and Andres were explaining, so when we had this compilation of the different indicators and resources, we thought about how do we make it user-friendly. And then we just decided to come up with a dashboard which pulls all resources together, so any user is able to easily navigate and see whichever kind of results or indicators that they are looking for pertaining to SBC. And before I dive in, I just want to talk about what is contained in the dashboard. Overall, the dashboard has 7 pages. The first page is on the introduction. Then we have 6 pages of indicator sets categorized by 5 goal areas. That is categorized by UNICEF, as well as 1 page for the cross-cutting program areas. And then we also have 1 page which shows you the full indicator library with all the indicators in one place. So when you get into the dashboard, you'll come across these different pages like I've just mentioned. So there are 5 pages on the main UNICEF goal areas, and that is survive and thrive, learn, protection from violence and exploitation, safe and clean environment, and then equitable chance in life. And under each of these goal areas, you'll find areas of programming. For example, for Survive and Thrive, you'll find areas of programming such as HIV/AIDS, immunization, maternal, newborn, child, and adolescent health, nutrition, primary healthcare system strengthening, and risk communication and community engagement. Under LAN, you will find indicators pertaining to education. Under protection from violence and exploitation, you'll find indicators pertaining to harmful practices, that is ending child marriage and female genital mutilation. Then you'll also find indicators around violence against girls, boys, and women, adolescent partner violence, and violent discipline. Under safe and clean environment, you'll find indicators on WASH, that's on menstrual hygiene, hand washing, and sanitation. On equitable chance in life, you will find indicators pertaining to social protection and social policy. For cross-cutting indicator sets, which is also a page of its own, you'll find indicators pertaining to accountability to affected people, AAP. You'll find adolescent development and participation, climate change, environment, and disaster risk reduction, indicators on disability, early childhood development, gender equality, humanitarian action, local governance, mental health and psychosocial support, migration, and peace building. And you can see that all this is a very rich compilation of indicators. Let me jump straight away into how the dashboard looks like and how you can actually navigate that. I hope you're still able to see my screen.
Yes, we can, Sarah.
Okay, thank you. To access this dashboard, first of all, you need to visit www.sbcguidance.org. This is the website which hosts the SBC materials for external audiences. And in this page, you will either search for the menu of results and indicators by typing keywords here, or you can simply go to the understand page and scroll down where you will actually find the page on the menu of SBC results and indicators. Just click that and you'll be redirected to the page. It takes just a few minutes, a few seconds, not even minutes to reach the page. And then once you're on this page, accept cookies and just scroll down just below the introduction to find the link that redirects you to the Power BI dashboard that contains the indicators. So you just click on that and then you'll be redirected. So this is how the Power BI dashboard looks like. You finally landed. And to navigate the dashboard, first of all, as a pro tip, to have a full view, just use this button, the open in full screen mode, so you're able to have a bigger view of the screen. So this dashboard uses actually 3 sets of buttons. We have the menu button, which has the background and the 5 goal areas like we've just discussed, and then the cross-cutting program areas page. You can use the back arrow to collapse the menu. The second set of buttons that it uses is the forth and back button, which help you navigate the dashboard even without using the menu button. The third set of buttons that you can use on this dashboard is the search indicator library, which will redirect you to a page that contains all the indicators in the dashboard. So for example, I want to look for an indicator under LAN. That's on indicators around education. I'll just come to the menu and click on LAN. I'll be redirected to the page on LAN. While on this page, just like other pages, you can search indicators by keyword or by filters. On the filters, we have areas of programming, like I just mentioned. And for example, for LAN, you have only education. Then you can also search the page using indicator level. You can search by end outcome, intermediate outcome, output, and process indicator level. And then you can also search by the behavioral drivers model driver, where you have the different components like Becca just discussed. And then you can also search the table by the socio-ecological model level. That's on individual, family, community, institutions and services, policy, society, and environment, etc. And for every search that you run, the system will show you the number of indicators found for your particular search. Should you want to learn more about an indicator that you've an indicator search or an indicator that you've selected, feel free to just hover over the indicator, give the system a few seconds for the drill through option to appear. Once the drill through option appears, just click on see indicator details and you'll be redirected to a page with indicator notes. Now, we have indicator notes such as the indicator text, the goal area, the area of programming, the SBC key result, the indicator level, the indicator reference, the purpose of this of the selected indicator, the link to online data if it is available, the BDM driver if it is available, the socio-ecological model level, the sample measurement tools and questions, the means of verification, the method of computation, and considerations for use. However, as you go through the different indicators, you'll find that not all information is readily available. But since this is an evolving resource, all information becomes filled out as it becomes available about a specific indicator. To go back to the main table, you just click on the back button and you'll be redirected to the page where you were. Should you want to search the entire indicator library, that is to see all indicators across all goal areas and cross-cutting program areas, you can click the search indicator library button and you'll be redirected to this page. The unique feature about this page, which is not on the other pages, is the goal area filter. This is because everything is just here in one place about all goal areas and cross-cutting program areas. So you can still filter by your select goal area and you'll be able to search the indicator table. Similarly, this page as well works just like other pages. Should you want to return back to where you are, feel free and to click the back button and you'll be redirected to where you were before. This is overall about the dashboard. I will stop presenting that and I'll just go back to show you more resources that we have available on the sbcguidance.org. We have various resources pertaining to the menu of SBC results and indicators, such as the main page itself. It's available in English and French. We have the SBC menu of results and indicators dashboard that I just showed you. We have the SBC global and applied theories of change. We have the behavioral drivers model notes. We have the social ecological model notes. And then we also have pages on the standard indicators for both cross-sectoral and emergencies, as well as the humanitarian action for children appeal SBC indicators, just as Becca and Andres were discussing earlier. These are also videos that you can play to additionally show you how to navigate the dashboard, just in the event that I wasn't clear at any one point. So one is in English and one is in French. Thank you, and I think it's now time for any Q&A.
Thank you very much, Sarah. If you can go back to the slide on the resources, I just wanted to make a quick mention to something that it's important that we have receiving questions in the past, and I see a couple of questions in the Q&A area, which is related to dissemination to partners. So one of the reasons why we put all those resources there and we put all these methodological notes also on the SBC guidance is that then it can be easily disseminated through you with other partners, and in case you need to use these also for advocacy purposes. So the idea of having the indicators and the work stream that UNICEF is doing on SBC programming specifically for measurement is not only that we have indicators for reporting indicators, also to have an advocacy effort to integrate results related to social behavior change at higher level frameworks. So we are able to integrate these also in national development plans, to integrate these on national planning documents, for example, for immunization, when we're looking for uptake of vaccines, when we're addressing, for example, issues like beliefs about vaccines or community engagement processes. The same for harmful practices, education programs. So the ideal dissemination, and this is also a call for action, is not only to take these different tools as monitoring tools, but also as advocacy and planning tools that can help integrate better program results. The second element that I wanted to highlight here is also the videos, because we want to be make it easier, that when people think of indicators, that doesn't have to be dry, it doesn't have to be complicated. So these videos, we have videos in English and French. We're going to be publishing this week videos on Portuguese and Spanish as well. So they are short, they are less than five, I think they are 5 to 10 minutes. So if you are to engage with other colleagues from other organizations, from with government colleagues especially, that they don't have much time to explain and do a walkthrough or even go through with this 1 hour video, be it 1 hour presentation, you could easily use these as advocacy and introduction tools. So just wanted to take a brief pause on the importance of these tools that are available for you, and hopefully this way we can see SBC more integrated, and that's going to benefit everyone, right? This is not just about one specific organization. It's about the sector strengthening our work, and our evidence, and also the different way that we portray the things that we're doing. So just wanted to quickly highlight that on one of the questions that we saw there. So yes, another question that I see there, and please put them again. You can also vote for the questions, so we can see which ones are more, popular, and you can give them a like. Another one is, for example, from Etienne, who is working in Morocco. He's asking, for example, about the specific behaviors. If these indicators only work for behaviors that are measured very constantly, or these can also be used for different type of behaviors that are new. I would say in general, and that's what I wrote in the answer, but I think it's important to mention here, the way that the standard indicators, for example, that we present are built is that they can include any different type of behaviors. So there's not a problem with adapting the indicator itself. I think here the question is more, then the next question should come, right? Which is what data we have available, and then what data we can collect. Because if we have a beautiful indicator, but we don't have the means of verification, if we don't have the specific way of measuring it, if we don't have like the resources also as well to do, for example, a survey, then that indicator is not going to yield results. So I think that now that we have more tools available to us, then we need to ask ourselves the next question, which is what data is there present? What can we be asking then to governments, to local partners, to also be collecting? One thing that we've been working on, for example, in UNICEF, and we try to integrate this more in country programming, is that we use more, for example, a survey, quizzes when we do trainings, so we can measure uptake of skills, training skills. And that's something that is not that expensive to do. The same thing when we're looking for satisfaction surveys with partners when we're having emergencies. Just having this is an AAP approach that is widely used, but also bringing it also more to social accountability approaches. So these are like specific ways to increase the way that we are measuring things without having necessarily a big budget. There are other more sophisticated approaches that could be available. For example, when we're thinking on large population surveys, we don't have to do a national survey that is super expensive. We can do a mobile phone survey that usually it's about to 1/3 to 1/10 of the cost of a national in-person survey. We also have developed similar methodologies that provides robust results. These are called the community rapid assessments. We have done this through COVID-19, recently on MPOX, and also in engagement with faith leaders. So we would also be happy to share more about these other types of approaches. So this is another part that I think we wanted to answer, which is about the specific ways of data collection and also how we need to work also strengthening evidence. But yes, Sarah, were you able to identify perhaps any question that you would like us to address at this moment?
Yes, I think it's on whether or not the people working in emergencies, especially offline, are able to access the dashboard even without internet connection. Yeah.
Great, thank you.
Would you like me to respond to that?
Yes, of course.
Okay, yes. The dashboard is actually downloadable. You can download the dashboard and you can have it offline. Yes.
Great. Then we have a question about, for example, that this is a really great resource. They are asking that usually we would need a big enough representative sample to measure the baseline and then the end line, then to measure the selected indicators. And they're asking, knowing that you might not be able to do an interview of the same people pre and post, how can we do this in a simple and cost-effective way? So this goes a little bit back into my previous answer. So now that we have the tools, we have also to think of what level we're going to be reporting. If we want to be reporting again for impact, for example, if we want to be reporting for impact evaluations, then we need a design that takes into consideration the pre and post, right? But then if we need to do that, we need to budget for that. So that it's also then a question about available resources. If we have an ongoing program, that doesn't mean that we cannot include new indicators. It just means that we're not going to be able to we're not going to be able to say with a degree of certainty that there is a specific impact of the program we're doing. However, there's always the approach about contribution. And in general, one of the things that I recommend people working on this space is to think more about contribution rather than the specific attribution that we're giving to our programs. Why? Because social and behavioral change programming as an approach does not work by itself. It's one program that contributes to the results in education, for example, or the results in health. We are changing one specific behavior towards another result. When we're changing the attitude about the uptake of vaccines, for example, but the uptake of vaccines contributes to a result, which is reduction of death of children or young children, for example, of increasing the survival of children. So in that sense, this is one element across multiple, and it's very difficult to isolate. So even if you had a very complex impact evaluation study, it would be difficult to say this is the one and specific result that gives this many increase in percentage. So in that sense, what we try to focus more with these indicators and also with the evidence approach is more on the contribution aspect. Of course, there are ways to also do impact evaluation studies, and we have colleagues who are working on that. And here I want to call my colleague Cash, who is our senior behavioral scientist, who's working on this area. But I think that one of the strengths that we have is to think more on this contribution, and especially the role that we're taking with bringing communities in the center of what we do, to the degree of what they are feeling ownership, to the degree that they are also pursuing the same results and having trust about the programming that we're doing. This is a specific area that we know we lack indicators on, and I think that we have done an effort to try to integrate these type of indicators in this approach. So that would be my answer for now. But if you want to discuss more, you can always reach us by email. So I also wanted to bring that. There was one comment that, for example, they were asking about how to use this for faith communities engagement, because this is one area of programming that we're doing a lot of in UNICEF, and I would believe a lot of different partners are also doing. So many of these standard indicators that we presented, many of these indicators that are present in SBC, many of results could be adapted. We have worked with adapting some of them, especially the ones about trust. We have done some studies about faith leaders as well. So in that case, we're available to work with you. We're available to provide, think with you how we can adapt those indicators. We have done that with some country office for UNICEF. If you are from other organizations, we're more than welcome to also think with you how you can use these tools. That's part of our compromise as UNICEF SBC team to also help strengthen the sector. So you can always reach us, and specifically, you can always reach me to at AOCHOA at unicef.org. A Ochoa, my first name A and then my last name Ochoa at unicef.org, and then we can have a conversation. This is it might look daunting to tackle these different indicators, but once we get to the details, it doesn't require that much of work as perhaps we would think. And also bring your monitoring colleagues as well. We would love for them to know more about these tools, and they can also include them on their work as well. Is there other question perhaps that you identify, Sarah, that you would like to ask either or Rebecca that maybe you will also like to address? I'm seeing some of them, but not all of them. Right. There is one. You can go, Becca or Sarah. I have another one here. No? Okay. So there is one. This is a good discussion, right? Stephanie from the Caribbean office is asking us, how are we going to adapt this to what is going to be the new UNICEF strategic plan? And this is important. And just to give you context for those that are not UNICEF, when we say sectors or goal areas here, we're speaking about specific ways of organizing the results for UNICEF. And in the past, this meant organizing them in things like education, child protection, health. So with the new strategic plan, there is going to be a little bit of a reorganization. So we will have to readapt that structure. So what Stephanie is asking is are we going to change that, or are we not going to keep this structure? I think that thematically speaking, you are still going to see the results related to the specific program area. So if you go to for example, the immunization, you're still going to be able to go to immunization. If you think of mental health is going to be there. Harmful practices, the same thing there. Maybe what we'll need to do is add a different layer that speaks of these new results. Why is this important to other organizations? This is not only UNICEF speaking to UNICEF. It's because usually when we do an adaptation at the level of strategic plan is because there is a conversation with governments of the best way of including results for children. So in that sense, this has been the result of a revision with member states of how we can organize those results. So it would be useful later down the road also to understand this, but you are going to see this reflected on the menu of results once this is finished. We're still ongoing on that design, and then we will adapt. So for sure, you're going to see that UNICEF colleagues, and also for the different colleagues, if you see something new that perhaps wasn't there in the past. Then we have another question. This one is from Octave. So Octave is asking if these standard indicators can be integrated into national data collection systems as mix or vaccine coverage surveys. And this is one of my favorite questions. So why is one of my favorite questions? Because one of our areas of work is trying to have more social and behavioral data, right? The only way that we can really show that the programs that we're doing across the different partners, across the different agencies, is we have available data then to show progress. And the only way to show this at a national level is to have national data. So yes, these are built to advocate towards that purpose. It's a process. Usually what we recommend is integrating it first on your programs and then trying to build up from that program. So build up from that program, then to have to a national, for example, a survey that you may do as a pilot. And then with that pilot, show the results of what is showing at the country level, and then what are the potential implications of having these in the long term. I think it's a useful exercise. It's a long-term advocacy exercise. It's not only about SBC in itself, it also requires the support from other sectors, as then we will able to collect data that is important for results across different areas. So yes, this should be able to be used for exercises like mix. But there is a process that we recommend also starts with building data at the local or the regional provincial level to show its potential to then escalate. Yes, and so Ruwaida is asking, why are the standard indicators different from those of the dashboard? Yes, the important clarification because I don't want to confuse people. The standard indicators are not different from the dashboard. They are in the dashboard. These are a group of indicators that we wanted to highlight because these were created with a specific purpose, which is to have standard results that can be adaptable for multiple SVC programming. What we have in the menu of results are indicators that are very result specific. So we have indicators that are result specific for immunization or for adolescent participation, but they have not been yet thought of how they can be adapted to other areas of programming. So the standard indicators is the next step. It takes some of the most known and used indicators, and then we have adapted them in a way that can be used across multiple areas of work. So in a sense, it's a subset of indicators that then will allow you to use in new areas that perhaps didn't have indicators before, because that might be the case. We have a good work of previous indicators, for example, in harmful practices, in child protection area, that look, for example, about change of attitudes or change of beliefs, but we don't have that in new areas. For example, we have an area related on climate and climate change. When we have behavior change related to climate, we don't necessarily have indicators yet developed for that. So the best way to do that is look at what's already existing there that has been useful and works, and then try to adapt it, maintaining the same structure and maintaining also the same way of collecting data. So the standard indicators is already a step on that because it allows you to have something that can easily be adapted. It has the methodological notes. Again, let me highlight that because it sounds like it's a note doesn't help much. But when you're discussing with statistical partners, when you're discussing with national authorities, just to be able to say there is a methodological note behind this is a big step and it's going to be very helpful. So use that research. Don't forget about the methodological notes. And I think that we're finishing. So I just wanted to thank everyone for your time with us. I want to also thank all the people who have been working on this. Sarah, Becca, Gonzalo, who's with us, Audrey for supporting this specific webinar, Max and Vincent always for supporting this track, but also all the people who have worked on this in the past. We also have Rania, who was part of our team, and who also started this project in the past. The previous people working on planning and monitoring in UNICEF always have been our effort to try to build the capacities and the vision towards evidence on the sector. So this is an invitation to keep thinking with us how to strengthen this area more. This is an invitation to also use these resources, and let's continue the conversation. We're available to talk with you. We hope this will be useful, and we hope to hear from examples of you implementing and using these indicators in your day-to-day work. So thank you. Max, please.
No, thank you, Andres. Thank you, colleagues. I just wanted to actually also acknowledge the high quality of all the colleagues that presented today and all the work that has been put together. So, of course, from my side, for the colleagues, particularly our external partners, if there are at some point some additional work done by them to, for example, expand the indicator set on other programming areas that perhaps are a bit outside UNICEF mandate, we would appreciate if these can be shared with us so that we can actually keep tracking and further build these resources. So that's what I wanted just to request our colleagues to support us in that sense. Thank you so much and have a good day.
Everyone, thank you.